Hello, my name is Kabir Nath, and I'm the president and CEO of Otsuka's North American pharmaceutical businesses. It's my very great pleasure to introduce our guest speakers for today's conversation, Dr. Altha Stewart and Dr. Valerie Purdy-Greenaway. We're here to talk about the impact of systemic racism on the mental and physical health and the well-being of the Black community. If I might, I wanted again to move the conversation a little towards the impacts of the systemic racism, which we've now, I think, characterized in a number of different settings, schools, academia, and the corporate environment, but the impact of that on mental health, because clearly there is a strong impact there. And perhaps you could both speak to some of the ways in which persistent discrimination, systemic racism does indeed impact on the mental health of people of color.
Well, clearly, anything that severely compromises one's sense of self, and certainly a positive, confident sense of self, is going to have a negative impact on your psychological well-being overall. And in America, we have historically devalued and dehumanized a group of people from their first setting foot on the land here. Success is based on a sense of confidence in oneself to do something, to be able to do something, to have an opportunity to do something. When you take away opportunity, when you take away ability to learn, when you take away ability to see yourself as a positive human being, you literally are stripping away the positive psychological aspects of people. And in the work that I do today, a fair amount of work, since I work with kids a lot, kids and families, a fair amount of the work is to undo some of that traumatic damage that is the residual from generations of heaping on unfair, unequal, harmful, threatening to one's life and limb kinds of things that have gone through various iterations over the generations. We have today, for example, a history of misdiagnosis of mental illness based on how we perceive symptoms to be manifested if you are white versus Black. We have, to your earlier point, Dr. Purdy-Greenaway, we have lots of research that says this is happening and it must stop. And when it doesn't stop, we get people with worse treatments or ineffective treatments or wrong treatments, to be quite frank. And yet we are not following the research and the studies and listening and acting accordingly. We have a whole host of diagnostic categories that for a long time did not even take into consideration what the cultural impact of, if I am a Pentecostal evangelical Southern Baptist, and I tell you, when my family brings me in and says something is wrong with her, and I tell you I am communicating with my dead grandmother who always looked out for me, and you define me as psychotic, I'm likely not going to come back to you, and I'm not going to take that medicine because culturally that fits within the context of my existence. That is not the evidence that I am psychotic. Now, I may be psychotic, but that's not the evidence any more than Black women presenting as angry if they are depressed and really angry and like on the edge angry and almost homicidal, as opposed to sad and blue and wanting to just lay in bed. There are cultural variations that are different from what we have always talked about as culture-bound syndromes, but there are cultural variations that we are not yet taking into full account as we look at mental illness in African Americans. Everything from depression to anxiety disorders to ADHD in children. So many young boys, and I keep going back to boys because I think there is, from a historical perspective, I think there is a connection between the fear of many of Black men. And if we can start to control them as boys, we are less likely to grow into men who will be threatening. They are less likely to grow into men who will be threatening. But look at the number of young Black boys who are diagnosed with some kind of disorder, conduct disorder, explosive disorder, attention deficit disorder. How many of them are accurately being diagnosed and medicated? And then you layer on top of that, the kinds of medicines that we used are not the easiest to convince people to take because they sometimes come with some side effects. And while they can be managed, if you have a history of not trusting, and you have reasons to not trust the medical community around taking good care of you and yours, then you run into this, and I see this so much where I spend a fair amount of time explaining to, and it's usually a mom, explaining to a mom why I think in this case, we really ought to try something to give the child a chance at being able to be a success. I understand the concerns about medication. I understand the fear of this is all part of a great control conspiracy. I get it. You know, I've been Black all my life, so I get it. But I'm also a doctor. And I also understand a bit about the science, certainly about the pharmacology of this particular thing. And it really requires, I think, if we're going to do a good job of providing high quality mental health care in the Black community, I really do think two things are going to happen. We're going to have to become much better versed in understanding culture and understanding culture. And I don't just mean, you know, the cultural competency sessions that are provided and training on, if you're treating a Black patient, remember this, or if you're treating an Asian patient, remember this. I really do think we're going to have to drill down and understand the culture, the behavior, the help-seeking behavior, the understanding that they have of normal versus not normal, the use of terminology. That's the first thing, that understanding culture piece. The second thing I think is we're going to have to, and by we, I mean those of us who are in that provider group, are going to have to relax the rules and allow communities to be our partners. This cannot be a top-down discussion. It really has to be a dialogue around, I recognize your concerns, I appreciate your fears and anxieties, and here's what I have to offer in response. And that this is, in many respects, a negotiated peace settlement, if you will, that medicine and healthcare have done some horrible things in the name of science. And it's perpetuated some horrible wrongs on a people who came with being wronged to this country. And if we don't do something to begin to show penance, at least, for some of that wrong, and to incorporate some of what the community needs to hear in order to trust us, we won't make headway with helping people who seriously need our help for their major mental health problems. And I think, again, the pandemic is uncovering things where I have heard more Black people admit to being depressed, to using the word depressed, than ever in my career. And it is unfortunate that we had this level of pain that forced them to face that this is not just, I can't deal with it, I am depressed and I need help. I've got more Black women and families seeking help for their children than in my entire career, and asking for a Black therapist. And there just aren't enough of us. But that whole workforce piece, we have got to figure out how to model that corporate entity kind of behavior in the change in culture. We've got to overlay that into the medical culture if we're going to grow a workforce to meet the current need and the future need of some of the people who will need this level of care.
Amen. Right on. So true. And I'm an experimental psychologist, so I'll take a different tact to answer the question about what are we seeing in terms of the impact of systemic racism. And what you see is the emphasis is usually on the negative. And when you look at sort of what are the physiological and the psychological mechanisms, one piece is just stress. And stress does terrible things to you physiologically. Stress does things to you mentally, but that's the mechanism. One of the mechanisms is increased stress. Another of the mechanisms is just increased anxiety. And another one of the mechanisms is um, it's sort of called like sort of a lack of shared reality, in the sense that if you are experiencing something, treatment towards you, and then others are saying that's not happening to you, that creates this experience of discordance. And you're like, did that just happen? Did that just happen? And what that does is that in and of itself contributes to stress. And you see these mechanisms in the workplace, you see them in schools, you see them in the healthcare system. But the other thing, which is less well studied, is you see this incredible resilience. And there is, the research isn't as sort of well understood, but the ability to continue to go to work in the face of experiences of racism, or the ability to continue sending your child to a particular school, that is sort of this incredible resilience. And one of the things that I've done a little bit of work on, that I kind of have I just sort of worry about, which is called skin deep resilience, which is the idea that sort of on the face, people appear to be coping positively, sort of in explicit measures, like I seem to be doing okay. But physiologically, you see this incredible decline that links to things like type 2 diabetes, certain forms of cancer, certain forms of cardiovascular disease. So it is crystal clear that racism makes people sick. That is crystal clear. That not everyone, not all the time, but that in and of itself makes it a public health crisis, because that gets linked to the healthcare system. You see it at very early ages, in adolescence, in adulthood. It gets linked to mortality. I mean, that work is absolutely crystal clear. But also what I think of as the positive side is the ability to navigate these situations gives you an incredible set of leadership skills, an incredible sort of way to kind of move throughout the world. I'd rather have a world in which racism didn't happen, but the ability to contend with it over time allows sort of gives you another, I think, an armor that allows you to cope positively as well.